So I started Mindful Mondays to turn the subject of mental health from being a taboo subject to one that's openly discussed in public forums. I wanted us to be educated on mental health so we can remove the stigma that exists around it right now. So far, we've discussed many topics: depression, bipolar, anxiety, stress, panic, the simple things that we often overlook as a society.
That is Mrs. South Africa 2020 Shudifatsu Musida, who is saying it's okay not to be okay, and especially for women. She is using her platform to raise awareness and end the stigma surrounding mental illness. A recent study by a humanitarian organization, CARE, shows that during the COVID-19 pandemic, financial insecurity, hunger, and mental health were the great concern among women. The study shows 27% of women suffered an increase of mental illness-related challenges, while for men, only 10%. Hello, I am Simbanyi Shegoya, and this is Our Voices. Today, we will take a look at women's mental health and how the COVID-19 pandemic affects their well-being. We'll see how therapy is breaking the stigma around mental illness, such as anxiety, depression, and suicide in some parts of Africa where they are no longer taboos. This and more on today's program. Aid groups say the COVID-19 pandemic has caused greater suffering to women than men, especially in developing countries like Kenya. Leni Ruvaga presents how one aid group is helping women during the pandemic in this report from Nairobi.
Kenyan beautician Cynthia Okewe was full of hope when the business she opened 4 years ago started making a profit. But the COVID pandemic slashed her income by more than 80%, making daily life a struggle and sending her into a deep slump.
So many people have died and I've done so many things because of COVID. And now, even me myself, I got the counseling because I needed to understand myself and know and cope with the COVID-19 and know what's going on around me so that I can cope well without hurting myself, because I got into depression because of the COVID-19.
Okewe got telecounseling help from the Center for Rights Education and Awareness in Nairobi's Kibera, Africa's largest urban slum. The counselors target women and girls who they say are more vulnerable to pandemic shocks than men because of fewer jobs and higher job losses.
With COVID, a lot of things have happened. We've seen an economy that has gone down. We've seen jobs have reduced. So even the small jobs that are available for the women is no longer there. So women are actually strained and they find themselves in tight situations. They have to provide, yet there are no job opportunities.
The counseling service is supported by aid group Care International in Kenya, which has been advocating for women's rights for more than 2 decades. While the COVID pandemic posed a new challenge, the group tells VOA it managed to help about 9,000 women so far.
The psychosocial aspect has come in very strongly because of the need of the differentiated impacts of either COVID-19 or any other issues that women and girls have been facing in Kenya. And this actually has meant that we need to support them to receive psychosocial support because of the mental health issues and also the other effects of COVID-19 on their health.
The United Nations Women's December Gender Assessment Report found nearly half of women-led households affected by COVID needed economic and social support. For thousands of women like Okewe, the counseling has provided a much-needed lifeline. Leni Ruvaga for VOA News, Nairobi.
Uganda hosts Africa's largest population of refugees, and psychologists say the rate of attempted suicide among them has jumped during the pandemic. Reporter Halima Athumani looks at efforts to help those who fled physical danger only to suffer from deadly mental trauma.
22-year-old Meta Justin from the Democratic Republic of Congo was already living a hard life in one of Uganda's refugee settlements. When the Ugandan government announced measures last year to control the spread of COVID-19, life got even harder. With little or no work available to locals, Meta, who previously survived on casual labor outside the settlement, had no income to supplement the aid his family was given. For Meta, who lived with 5 siblings and a jobless father, it was the hunger that almost got him to take his life.
We slept 2 times without 2 days without eating food, or just surviving on just porridge, bit of porridge, which sustained us for the bit of moments. And we really, I really, by then I was like, if it's like this, which means it's useless for me to stay in this world.
Mamoru Jackson, a refugee from South Sudan, says it was the lack of human interaction that pushed him to the wall. Having fled to Uganda with a younger brother, leaving his parents in South Sudan, Mamoru wasn't ready to assume the role of a parent.
Actually, that thought came into my mind.
Why?
Because I feel like I'm alone in this world. And also the work at home, because I was the only elder person, the other brother of mine is still very young. I feel overwhelmed.
Malay Ali, a psychologist and counselor, says both Justin's and Jackson's conditions were deepened due to the thought of not being cared for after separation from family. He outlines the underlying issues.
Parental abuse, poverty, those who have been stricken, and then those who are traumatized, especially those who faced violence, exchange of bullets. Now, like for the refugee dwellers, that they really had a lot of post-traumatic stress that was now facing them, transitioning them to another stage of contemplating suicide.
Psychologists say the contemplation of suicide takes place in stages. These include losing hope, planning on how to end their lives by either using an overdose, poison, ropes, or falling from high elevations, and finally accomplishing the act. It is at the second stage that psychologists say people at risk must get the attention they need to prevent them going through with suicide.
Illnesses, for example, like depression, in African cultures are not recognized as mental illnesses. So I think there's a need for people to understand that. I mean, if you see a relative, for example, talking of suicide, don't take it lightly. I mean, the person probably is already entertaining those ideas.
Some signs psychiatrists say one should look out for are withdrawal, crying, self-isolation, loss of interest in formerly pleasurable activities, and lack of sleep. Halima Athmani for VOA News, Kampala, Uganda.
Suicide is preventable, and that's why World Health Organization, the WHO, recently released a comprehensive guide called Live Life to help countries bring down the rates of deaths by suicide. Currently, 1 of every 100 deaths is caused by suicide, and the World Health Body aims to reduce this rate to a third by 2030. These approaches are limiting access to the means of suicide, education, and fostering socio-emotional life skills. Now, we are taking a short break, and when we come back, we will take a look at how people are seeking creative ways to support their mental health. That's coming up next, and don't go away. Welcome back. You are with Our Voices. The WHO says the COVID-19 pandemic has caused 93% of countries to halt critical mental health services, making it even more difficult to treat these disorders. VOA's Yavit Mavinga reports from Democratic Republic of Congo on how one psychiatric center has been treating the influx of people suffering from severe mental illness.
In this psychiatric center, on the outskirts of Kinshasa, some patients have barely emerged from adolescence. This is the case of Nelly, 20 years old. This young woman has been exhibiting behavioral problems for a few days. She could not bear the death of her grandfather, which occurred a week earlier.
She cried a lot the day her grandfather died. It affected her deeply as he used to buy her gifts and give her an allowance. She started to make a mess in the house. But now there is a change as she talks less and less and is less agitated.
In the next room is Carol, a 35-year-old single woman who claims to be married and a mother of 3 children. Inconsistencies which attest to her psychiatric state. This is her 3rd relapse in 4 months, but she finds it difficult to come to terms with her current mental health.
I am 60 years old and I have 3 children who live with me. I only live on this bed. I think this is my life.
Since its creation in 2005, Dr. Enciala's center has already received more than 10,000 patients, or an average of 4 patients per day with different symptoms. The most striking are the instability, the violence, and especially the denial towards the state of their mental health, a situation that gives doctors a hard time.
You have to deal with someone who has practically lost their mind and who must be brought back to the norm, which requires a lot of effort from us. And that's why a psychiatrist visit takes at least 45 minutes.
Le moins de temps possible que ça puisse faire, c'est 45 minutes.
Treatment in psychiatry has 2 components. There's the medicinal component, or psychotropic drugs of several types, as well as the psychological treatment, where the patient takes part in behavioral psychotherapy or group psychotherapy. There needs to be some knowledge.
La psychanalyse, on utilise la psychothérapie. On peut faire une psychothérapie comportementale pour un individu. On peut faire une psychothérapie de groupe où l'individu est inséré. Et là, il faut certaines connaissances là-dedans.
Psychiatric or neuropsychiatric illnesses can be caused by hereditary, environmental factors, or side effects of other pathologies. Psychotherapy makes it possible to recover the majority of the patients. Aimé got away with it, but came back for a checkup.
J'ai fini avec le produit il y a quelques mois passés.
I finished the treatment a few months ago, but I continue with the appointments. Maybe the last is today.
Il faudrait respecter par la suite. Peut-être ça serait les derniers aujourd'hui.
According to the country profile of DR Congo, which appears in the Atlas of Mental Health of the World Health Organization, the WHO, there are 3 outpatient establishments and 8 treatment establishments in the whole country. 6 of these 8 establishments are psychiatric hospitals, the other 2 being psychiatric divisions of general hospitals. For internment in a psychiatric hospital, according to the WHO, there are only 0.4 beds available for 100,000 people in the DR Congo.
It is estimated that among 21.6 million people who live in Ghana, over 650,000 are suffering from severe mental illness. I recently had an opportunity to speak to John Wick-Nathan, an American healthcare expert with extensive experience working in Ghana.
Mental illness is oftentimes triggered by trauma. And as you know, there's a great deal of trauma. There's a lot of trauma that happens, and so for a person to, let's say, for example, to see their parents shot and killed, which is to have their sibling abducted, right, or to just be completely mistreated, and or have an experience that's solely based off of just being out on the streets. There's a lot of things that would have seemed uncommon or wrong in our eyes, but would be common to them. Mental illness is now overlooked because things are so common. They're not aware, or I would imagine also not necessarily educated and or have the resources to address it.
It's also the most disregarded health problem in Africa. Treatments are barely available. How does that look like in Ghana?
Treatment in Ghana, as of right now, specifically, there's not a lot of opportunity there. Right, and so I understand what it takes to actually help a person go from their current situation to where we would like them to be. Their approach right now is to add departments. I told them, I said, well, departments only creates a revolving door. They come into a hospital for an emergency and then they leave right back out and then they go back in when there's another emergency. But we're not really helping the core problem here. And so I asked them, I said, well, where are the counselors? Where are the psychiatrists? Where are the therapists? Where are the social workers who are out there kind of helping? Because these are all the things that I have in my company.
Now, COVID-19 is having a devastating impact on mental health in Africa. How will this impact? Has your work been affected by this pandemic?
I believe a lot of things have been affected by the pandemic. If anything, it's made it worse. In 2020 was the first time in a long, long time since the flu epidemic. So imagine all the people who have not been serviced. Imagine all the people who have not been able to be seen. Imagine the cases of mental illness that has skyrocketed. Imagine the use of drugs that have skyrocketed. If anything, we have a much bigger problem than we've ever had. The worst thing you can do for an addict or anyone who suffers from mental illness is to put them in a box. And that's what COVID-19 did to us in this past year. And in some places are still doing to some people. Right now, we're communicating via video call, which is what they call telehealth. We have to, I look at it as an opportunity, to be honest with you. Right now, the only problem is, how do you do that in a third world country who do not have the resources that we do? There's a multitude of different aspects of my clients' treatments, or I would say just our patients' treatment that we are actually able to control, right? From whether it be the group home aspect, from whether it be from the primary care aspect, from whether it be from the counseling aspect. So in other words, obviously we had to create a systematic approach to our admission program, right? And to make sure that everyone is safe. And once you're in a group home, now you have access to our to be able to participate in our clinic. If you are participating in our clinic, guess what? You have access to our doctors. You have access to our psychiatric doctors. You have access to our caseworkers. You have access to nurse practitioners. And so now we have been able to control and actually service our people directly. And these are plans that I've made prior before the pandemic. It just so happened that we have put these things in place. And when the pandemic happened, right, it worked out perfect, because the thing is, our clients did not need to leave our facilities to go elsewhere to receive treatment.
Do you only work in Ghana, or do you have other programs in other countries?
So we just to clarify, the project in Ghana hasn't been commenced yet. Well, we're raising awareness. Just to clarify that right there is a projection. This is what we want to do. We're coming up with a plan, putting the team together. As it pertains to what I do everything specifically in the U.S. right now, right, and that's what we're experiencing success. I think as of right now, in the past year, because my company is fairly new, and from the time that we began to now, we've helped a little over 150 people, right? Do all of them succeed? No, because these are things that a person have to make a decision. Aside from that, what's happening is that we are now looking at, all right, how can we better that project? So my team and I are coming up with a plan. I don't want to disclose just yet. They'll be able to help the masses to where we're supporting millions of people versus having a brick and mortar structure, right, and having people come in through there.
Nigerian officials say the coronavirus pandemic has a strong impact on the economy. Social distancing has tripled the number of mental health cases. In response, Nigeria launched the first toll-free 24 hours helpline staffed by trained psychologists and counselors. Timothy Obiazu reports from Abuja.
A crowd cheers as a mental health counselor responds to the first call on the COVID-19 psychosocial hotline during its launch in Abuja. It's Nigeria's first toll-free line focused on mental health issues and part of a joint effort between the government and a group of private counselors.
The virus has done a lot of damage to societies across the world, economically, socially, politically, and health-wise. That's why counseling becomes a very, very important instrument to control and to manage the behavior of people who have been affected.
Psychologist Aisha Abdullahi heads the team of counselors manning the helpline. She started free online counseling last year after seeing a significant jump in the number of mental health cases after the pandemic began. She says more than 5,000 people reached out, and she expects even more to seek help through the new helpline.
So this is a pilot phase, right? We are anticipating that we're going to get a lot of calls, and we are looking at expanding. So that's why we're calling on partner organizations, collaborations, so that we will be able to expand and be able to meet up to the needs of the calls that we get.
Experts say the number of people needing mental health services tripled during the pandemic, but they say less than 10% get help because of the stigma attached to it. Pelemo Avanyaju says she suffered from depression for years after a surgical procedure on her legs. She says she overcame suicidal thoughts after working with Abdullahi.
I was already in seclusion. I was already isolated because everyone would go out, go to work, go to school, and just leave me alone in the house. So I was always alone. And that gave more room for the negative thoughts to grow and to affect me mentally.
Authorities and the team of counselors are hoping that a toll-free line will help increase awareness and the number of people who get the help they need. Timothy Obiezu for VOA News, Abuja, Nigeria.
The COVID pandemic's economic and social impact has stretched mental health in many parts of Africa, including Zimbabwe. But some Zimbabweans who were hit hard by the stress have found a unique support at the Friendship Bench. Columbus Mavunga reports from Harare.
Friendship Bench started in 2006 to provide counseling to those stressed or depressed by the political and economic situation in Zimbabwe. The organization now has branches at most clinics and hospitals in Harare and is the only large mental health therapy service operating in the country. The service is run by volunteers who say they do not want to see people stressed. According to Chengetanya Mukapa, country's coordinator for Friendship Bench, many people have stopped meeting others in person due to COVID-19.
We continue to provide counseling to people who are affected, who are infected by the COVID-19 pandemic. And again, we are saying that we are not able to do that using our conventional face-to-face. But what we have done as an organization is to migrate to an online platform.
But some, such as Elizabeth Chibeka, still come to their offices. The 49-year-old says her father is battling with COVID-19.
I have nothing to pay for his medical bills. I am unemployed. I have no means to raise funds even for his food. Those are some things stressing me. Hence, I came here to talk to these people. COVID-19 is there, and it's real, especially where we stay.
53-year-old Forgeti Gutuza is one of the counselors at Friendship Bench. She says COVID-19 is dominating her counseling.
COVID-19 has really spread its wings. It's all over, but people are not masking up. I do not know how awareness programs can be done. I wonder why people do not understand the situation we are in. My neighbor conducts church service nearly every day.
Dr. Deborah Machando is the chief of mental health for the World Health Organization's office in Zimbabwe. She says COVID-19 has caused a lot of stress to people.
Lately, we've been seeing a number of psychological disorders, including panic attacks, insomnia, depression, and also a surge in terms of family conflicts and violence. So there are a number of things that people can actually do to mitigate loss of income.
She says they include understanding that the world is in strange times, cutting down on expectations and adjusting downwards on needs. That must be advice for stressed people like Chibeka to take note of as the cases of infections by COVID-19 continue to spike in Zimbabwe, with the Delta variant on the rise. Columbus Mavunga for VOA News, Harare, Zimbabwe.
It's so good to see by just taking a seat on the Friendship Bench, one can have a greater access to psychotherapy. Do you think these alternatives of mental health services will change people's perception and break the stigma surrounding mental illness? Let us know on Facebook, Instagram, and Twitter. Our handle is at VOA Our Voices, and we are also on WhatsApp. Our number is on the screen. It's time for another quick break. When we come back, we will meet a woman in the world's largest refugee camp who is using downward dog and tree pose to provide solace to her fellow refugees in Kenya. That's coming up in this week's Women to Watch segment. Stay with us.
We're bringing women's voices to the conversation, and more than that, we're building a community of inclusion and empowerment.
Here in Kinshasa, campaigns to raise awareness against the spread of coronavirus are common, but getting that information to people who have no access to water, electricity, or money can be a challenge.
We are here at Kalerwe Market in Uganda, Kampala, where in this whole market, women are crying out for their situations to change.
For women, it will be better for us.
I think a big thing for me is just being able to say that when these protests are happening, does it turn around into policy?
Our kids are raped every single day.
This movement got the government to listen. It really was powerful because it showed what is possible when men and women band together and say, enough is enough.
It's not necessary anymore to climb on a car. I can be in any place to cheer with the people.
Welcome back. You are with Our Voices. It's time for our Women to Watch segment. We introduce you to Rita Brown, an Ugandan refugee living in Kenya's Kakuma camp, who uses the power of yoga to bring wellness and healing to her fellow refugees. With nearly 200,000 residents, mental health services are essential, but the access is limited in the camp. Rita Brown started practicing yoga after she arrived in Kakuma camp, escaping a conflict in Uganda that killed both her parents. It helps her forgetting the traumatizing experience she endured. Let's hear how she fights anxiety or depression using yoga.
I used to think I'm not loved. I used to think everything I passed through was like a destiny which God has planned for me, that I'm going to suffer for the rest of my life. But since I joined yoga mentally, spiritually, emotionally, I felt like yoga really changed me. Yoga is for all age, yoga is for all body size, yoga is for everybody.
Psychosocial counselors like Lynn Watera Karanja are also providing virtual counseling to the refugees living in the camp. Karanja says there are so many people to be served when it comes to mental health.
You find that there are so many people to be accompanied, there's so many people to be served, there's so many people to be advocated for, especially when it comes to mental health and psychosocial issues, which we know even with the COVID-19, that number has increased.
Namaste, Rita, and that's where we end our show this week. To watch this episode or catch up on other Our Voices programs, you can go to the VOA website at voanews.com. On behalf of my Our Voice colleagues and everyone here at the Voice of America, I am Simani Shekoya and thanks for watching. Good day.